Hello and welcome to week 10, PA113. You are in your last week, but this is still a lot of work in this last week. So I wanted to lecture a little bit about the chapter that we're going to be in and then review a little bit for your final exam. So this week you're actually in chapter 12. So your final exam will be from chapter 1 to chapter 12. And actually there's a lot of questions on the exam about this last chapter that we're going to talk about. So chapter 12 in your pharmacology book, we are starting on page 196, and hematologic drugs, hema meaning blood, any drugs that are affecting the blood. So we're talking about anticoagulant drugs like heparin, anything that will help to prevent clot formation, thrombolytic drugs to dissolve blood clots that have already formed, topical hemostatic drugs to stop bleeding, drugs to treat anemia, which is low iron, and drugs to treat hemophilia. So let's start with anticoagulant drugs, and this is drugs that help form a blood clot following a complex cascading series of steps involving clotting factors, thromboplastin, and platelets. So we're talking a lot about what's inside our blood and what it's doing to help clot it. The liver provides clotting factors 1 through 10, 11, 13. And it is depending on the presence of vitamin K. Vitamin K is actually found naturally in foods, and which is your green leafy vegetables. So if you turn the page on 199, you'll see all of the foods that vitamin K are in. So there's spinach, kale, tofu, soy milk, garbanzo beans, and so it says that patients taking anticoagulant therapy should monitor their dietary intake of certain types of food like leafy green vegetables, broccoli, Brussels sprouts, bok choy, turnip greens, because they contain large amounts of vitamin K that can decrease the therapeutic effect of anticoagulant drugs. This is known as antagonism. On the other hand, garlic has its own natural anticoagulant effect that can multiply the effect of the anticoagulant drug. This is known as synergism. So you really have to watch to make sure that the foods that you're eating do not interact with the drugs that you're taking. And so a lot of times the pharmacy technician, we will put a warning label on the outside of the prescription bottle, labeling it to say, watch your leafy green vegetables, do not eat with spinach, that kind of stuff. So the anticoagulant drug that comes to mind is on page 198, which is warfarin, which blocks vitamin K and keeps the liver from producing clotting blood factors because it wants to thin the blood. So warfarin, and the generic of warfarin is, which you should know in your drug words this week, I'm sure, is warfarin is the brand name. Why can I not think of the generic name? Coumadin. Bah! Just came to mind. Sorry. So warfarin, Coumadin, and this is one of the ones that if you've heard me lecturing before about if you need to stay on a certain medication, this is what they keep you on. So warfarin, you can't change back and forth from Coumadin to warfarin. If you're on warfarin, you have to stay on warfarin. If you're on Coumadin, you have to stay on Coumadin because there is that much slight difference in the drugs, the generic and the brand name, that it actually can affect your blood thinness, and they want to make sure that it's the exact same throughout. Going on and talking about hemostatic drugs, drugs to treat anemia, drugs that use to treat hemophilia, which is a specific clotting factor, and then talking about blood and blood products. So do you guys donate blood? I definitely do. I am a O, and so they are calling me every 6 weeks to donate my blood because they need it. And so you can read about that. Some of the experiences I've had in the pharmacy are with warfarin or Coumadin patients where they've come in, and you can tell the people who are on Coumadin because they have thinned their blood for so long because probably heart disease and things like that, that their and they're probably on aspirin, 81 milligrams, baby aspirin, to thin their blood a little more. Their skin becomes very, very thin, and you can see their veins almost. And so with Coumadin and warfarin patients, they are easy to bruising and can bleed easily, and so you don't want them to go into any type of surgery if they're on that type of medication. They can't take any extra NSAIDs. Remember, we talked about NSAIDs last week and how they thin your blood as well. And so NSAIDs are not to be taken with warfarin. You may take acetaminophen because remember that does not thin your blood. A little bit of review for you. So just to go into what your final exam is going to be like, it is 100 questions. I'm sorry, this light is awful. 100 questions, and it is through chapters 1 through 12. So what I would do is go back through your chapters, looking through your chapter reviews again, making sure that you're highlighting those questions again, that you're listening to any of my lectures, because that will help as well, so that you can really make sure that you know where everything is. You're allowed to use your book on the final exam, but flipping back between 205 pages can be quite hard. And so you'll want to make sure that you know where everything is and when they're talking about it, so that maybe you can answer a few that are very quickly to that. So again, first do your chapter 12 so that you know about the blood hematologic drugs and about the blood clotting and anti-blood clotting and that kind of thing, so that you know about that, and then go back through the rest of the chapters and review for your final exam. Good luck on your final exam. Make sure you give yourself enough time. Don't get stressed about it. And then from there, I will be ending no later. Everything needs to be turned in by Thursday at noon, and I will have your grades to you, your final grades to you Friday before noon. Okay. No, Thursday at midnight, right? Thursday at midnight? Yes. And then I'll have your grades to you Friday at noon. So nothing later to me, no late assignments, things like that can be turned in to me later than Thursday. All right, I hope you have a great week, and let me know if I can answer any of your questions.